So the first thing you're going to want to consider is the environment that you're going to be learning and ultimately practicing in. Emergency medicine is certainly a field of rapid diagnosis and resuscitation, and you want to be sure that you are the type of individual that is comfortable treating presumptive diagnoses and not requiring an airtight diagnosis like some of our colleagues throughout the hospital. Secondly, one thing that you're going to want to consider is that essentially all the patients we treat are in crisis. The environment can be chaotic, and this is something that if you choose to go into, you have to accept ultimately is going to be part of your work life. Finally, a consideration certainly should be that for the rest of your life you will be working nights, you'll be working holidays and scheduled for these, except for in very isolated situations. So that should be a consideration, and if that's something you're comfortable with, there's a lot of flexibility that goes along with that, but you need to know that going in. So should I do an away rotation? My opinion is that unless there are circumstances that are really, preventing you from doing an away rotation, it really is to your advantage to do an away rotation for a number of different reasons. But the two most important ones are, first, it will give you as a medical student and future resident in emergency medicine better perspective on what programs are out there, what types of programs, different formats, and ultimately what your career is going to be like in emergency medicine. Secondly, though, it will allow you to get another letter of recommendation from a training program in emergency medicine. And this is very important because this is the way program directors communicate between themselves or amongst themselves to really be able to evaluate you as an applicant to their program. It's very important, at least from my perspective, to see students who are choosing wisely and very deliberate about that decision. If you have gone through medical school in a kind of more formal medical school environment, go check out a community program, check out an urban center, go to a rural institution. This will really broaden your perspective on emergency medicine, but also importantly, it will show program directors and those reading your application that you are willing to take a risk, that you're adaptable, that you're malleable, and that you've succeeded in that setting also. You want to, first and foremost, be on time, be energetic, be motivated, be a team player in that department. And these are qualities that we're looking in all of our medical students. But importantly, you want to go a step further, okay? The exceptional medical students will have made that step to not only formulating their own plans, but developing them and applying them within our department in each clinical setting. So what I mean by that is, rather than simply gathering data and then inviting the senior resident or faculty member to develop the plan for them and then ultimately apply it, the exceptional medical students are doing that in their fourth year.